Today we're going to do a bag turnout, but not just any kind of bag turnout. We're going to do a medical bag turnout. So stick around.
This is Troy, Star.357.
Hey, I'm the gun snob.
Hey everyone, this is Obnoxious One, and you're watching the man, the myth, the legend, CloverTac.
And you're watching CloverTac.
And you're watching CloverTac.
Today we're going to do a little loadout and we're going to restock one of my med kits here. Before we get to that though, we'd like to talk about the bag I'm using just a little bit. Big thanks to Highland Tactical for sending me this bag. This is what they call their Pointer series. And when I first got this bag in, I thought, man, I know it's a range bag. It's got all kinds of pockets front and back. Got space inside for probably a couple of single pistol cases. But man, would this make a almost a perfect med kit for me. So that's what I've done. Now with any med kit, it's pretty important that it's properly identified. So I always have a patch or something on there. That way if you have to send somebody to get it, there's no question as to which bag they need to grab. And keeping in that tradition of marking things, you'll notice here on the back side, I've got one of the pouches marked with some red duct tape. That's because that is my Swat-T Tourniquet. This is going to be the #1 item I'm going to suggest that you have in your kit. Now if we go through some of these other pockets, I'm sure in this video you probably see bugs flying around, and so that's one of the reasons we keep the bug spray in our med kit. This other pocket here, we're going to have some extra bags. I'll talk more about the bags in a minute. We have scissors, and of course something all med kits need, we have gloves. Moving up to this little pocket here, we have a snake bite kit. And flipping it back around to the front, we've got our loop material for our patch. Got a knife. We have a flashlight. A good flashlight that you can hold in your mouth or that's hands-free. It's going to be optimal. We have permanent marker. And we have a pen. Going down into this compartment, a few cool things in there. I've got some syringes. You never know. More scissors. And we've got some first aid supplies. In here is triple antibiotic ointment, some alcohol wipes, and also some Steri-Strip. Now if we jump to the outside pockets, got just a bottle of purified drinking water. Have some isopropyl alcohol in this side. And in the opposite side, we have some first aid spray, as well as some hydrogen peroxide. Now, this bag has so many compartments, I have forgotten one. So if we flip it around, right in here, we have a little flap. Got a little notepad in there, always handy. Another pair of utility scissors. And this is a cool thing. Not everybody has these, and I'm going to tell you what, if you're ever with me and we have to go to this, we're in big trouble. But this is basically a surgical kit, and inside I have sutures and just your standard tourniquets. So now let's go to the inside of this bag. Like I said, lots of room inside. That's where a lot of the restocking is going to take place. Sterile water, a CPR resuscitator mask, a face barrier or a Microshield, as well as some calamine lotion and some lidocaine. Now there are some extra bags in here because I do have to restock a few things I was out of. So it's a good opportunity to show you the bags. And you'll notice on the bags I'm using, I use the freezer bags, the heavy one, double zipper. And I put little tabs on them as well. If your hands are wet, anything like that, you can really get a hold of those bags and open them a lot easier. But the bags give an added layer of protection if you're in the rain or something like that. Here we've got a bag with some tape. I've actually got some tape here. I like having a variety of tapes. You never know what the issue might be, so that's the plastic quick tear type tape in there, and then also we've got some paper tape as well. Seal that back up, put her back in there. This is kind of a weird one. This is gels and sprays and things. I've got a nasal spray, and if people are sharing this, you got to be really careful how you squirt it, and always, always, always make sure that you use those alcohol pads or something like that, clean the tip. And then, of course, some Orajel in here. You never know when you might get somebody that has a toothache or something like that. Now, even though we have some triple antibiotic ointment, I'm going to go ahead and I'm going to throw another tube in here just for good measure. Honestly, I think you'll find that with your med kit, you use that triple antibiotic ointment and bandages and things like that more than anything. I know that I always have. It's always the little things, thank goodness, right? Cotton balls or a half two, as well as the aforementioned Q-tips, so have plenty of those. This is a weird one not many people may have, but I think is important. A space blanket and a disposable poncho. Again, if you're out, cold, wet, those types of things, comes in handy. So this next bag has some interesting things in it as well, but things that can come in handy. I've got some hand warmers and feet warmers in here, as well as an icy hot pack. Now I'm going to add actually to this bag an instant cold press. Let's get one of those dudes out. We're going to put one of the instant cold presses in here as well. That way we've got all of our hot and cold solutions covered. Now you see it earlier, I had a flashlight in there, but went ahead and picked up a little cheap headlamp. This is just like a 3 LED model. Put off plenty enough light for you to be able to see in a sticky situation. And that's going to go in one of these outside pockets. That way it's easy to get to. Now another thing we're going to add, and we're going to throw it down here into our little quickie pouch, is some dechlorinized iodine. So you're probably thinking, hey Clover, you haven't mentioned bandages yet. What's up? And you're right, I haven't, because everything I pulled out of the old kit was brittle, it didn't stick, they were horrible. Adhesive bandages are bad about that. So I picked up a new variety pack, and we're going to restock. That's why I have the extra bags. We're going to restock with some nice new bandages. And you'll see this variety pack here. For the money, it's a pretty awesome deal. They're all different sizes for all different types of applications. Now that we have our new adhesive bandages all bagged up and protected, they're going to go in this big outside pocket. Why? Because as I said earlier, I use those far, far more than any other thing in this kit. So while I was picking up supplies, I noticed I did not have a whole lot of gauze. So I picked up this little wound care pack. It comes with all kinds of goodies in it, including some tape. So we're going to stock up on those gauze as well. We're going to go ahead and throw our gauze down in here. Now I'm going to find our bag with our tape, because I was not aware that that little package came with tape, which is cool. This is a paper tape. It's a little bit different than the other tapes I've got. So we're going to throw it in there too. Now it's important to me anyway, when I'm putting stuff into this bag, that I get as much air out of these baggies as I can get. It's really going to help you with the space inside there. And you'll notice we've got one more bag left. We haven't talked about medications. Now, first of all, I'm not a doctor, I'm not a nurse, I'm a fairly big medical idiot outside of CPR first aid training, outdoor first aid training, things like that. But I do like to keep a variety of medications, because some people are allergic to certain things, and if you're giving medication to them, you want to give it to them, let them take it, but you want to make sure that you ask appropriate questions first. Now, I said earlier that I use the adhesive bandages the most out of this kit. That's usually for other people. The things I use the most, honestly, are the medications. So let's go through the different medications that I like to keep around. Allergy medicine, something like Benadryl, some type of antihistamine. I have an allergic reaction to wasps. That is vital for me. People may get sick at their stomach, stuff like that. They do make a Pepto-Bismol that's, in a pill form for, nausea. It's the pink bismuth. So, but for nausea, diarrhea, heartburn, upset stomach, those type things. Now, as we get into some of the pain meds, you may laugh, but Midol is one of those things that has some extra ingredients. So this is a generic Midol. It's basically, it's caffeine. It has a diuretic. Yeah, it just works really well. If you have women, girls, things like that are on the range, well, you never know. One thing that I don't have here, I've got to add, I've forgotten, is an Excedrin. That's a pain reliever with caffeine, and it doesn't have the extra stuff that Midol does. Moving through the rest of the painkillers, we've got just acetaminophen here. That's basically extra strength Tylenol. Now, aspirin is one of those things that is not only handy as like a painkiller, but if somebody's having heart trouble or something like that, yeah, aspirin could certainly help out with that as well. Some people have a problem with acetaminophen or Tylenol, and I always keep some ibuprofen around, Advil, for those folks. And then finally, my choice of a pain reliever here is naproxen sodium, basically Aleve. And in my opinion, Aleve has some really good anti-inflammatory properties to it. I know it works really well for that on me. So let's see if our painkillers and our meds will fit into a bag. Hopefully we can get them all in there. If not, we may have to go to a bigger bag. Bam, there's our meds all safe and sound. I'm gonna put them in the top of the bag. Why? Because like I said, I actually use them more than anything else in the kit personally. So there you go, crew. There is my med kit. This is my large kit. This is the one that stays in the truck, that sort of thing. It's not one that I'm gonna have on my person or anything like that, obviously. But I am curious, and I would love to hear from you guys. Did you see anything in here that you carry in your med kit? Or do you have suggestions on maybe things that I need to add? Hey, drop those in the comments below. Be more than happy to talk about that stuff. Once again, big thank you to Highland Tactical for sending me their pointer model bag. That's what I've used now for my med kit. Well, thank you for watching. Until next time, don't forget to chain fire freedom.